Good afternoon, all, and welcome. I'm very pleased to welcome you to this afternoon's Global Evidence for Egypt seminar, and I'm glad to welcome all of you who are here with us today in the room and our live stream audience. We have a number of people who are joining us online, so welcome to those who are live streaming. I'm Allison Fahey. I'm the Executive Director of JPAL-MENA at AUC, which is the Abdul Latif Jameel Poverty Action Lab, and I'm very pleased to welcome you to today's Global Evidence for Egypt seminar. Today is the sixth in this series of seminars led by JPAL-MENA at AUC and UNICEF Egypt. And today's seminar will focus on early childhood development, discussing insights on how we can enhance healthy caregiver and community practices to promote early childhood development and encourage investments in long-term human capital development in Egypt. I'd like to give a very warm welcome to Her Excellency Naveen Al-Kabbaj, the Minister of Social Solidarity, a close partner to JPAL, to UNICEF on a number of important initiatives, and whose perspective we're really glad to be able to have in today's discussion on early childhood development. And I'd also like to welcome our other panelists. We have from the Ministry of Health and Population, Dr. Wael Abdul-Razak, the head of the primary health care and nursing sector at the ministry, and Dr. Karen Makour, professor at the Paris School of Economics and the co-chair of JPAL's health sector, as well as a researcher on many of the topics that we'll discuss today. I'm glad to moderate today's session, and I'd like to also add a small note to our folks who are joining us online. You're not only able to watch live, but you are able to interact with us live. So the live chat feature is enabled online. So as questions come up, please feel free to introduce those into the chat, and our team will make sure that they can be part of the discussion that we're having here today. So I'll walk you through our agenda and then tell you a little bit more about JPAL-MENA and about the goals of this seminar series. Our agenda for today, all right. We'll begin with some opening remarks from our panelists as well as from Jeremy Hopkins. We will then turn to the global evidence on early childhood development presented by Karen, and we'll then ground that evidence in Egypt with remarks from panelists from the ministries and from UNICEF Egypt. Our fourth panelist, I'll also take a moment to introduce, is Dr. Ines Higazi from UNICEF Egypt. She's the Early Childhood Development Manager. So introducing the goals of today's conversation. As a community of policymakers and development practitioners, we all know the complex nature of poverty and the challenges that exist in trying to improve development outcomes, as well as the real urgency in doing so. Our colleagues from the ministries, from international organizations, and from Egyptian NGOs have a critical responsibility to understand the underlying issues and then to design and to implement programs that tackle these challenges effectively and that ultimately aim to improve human well-being and to improve development outcomes. So at this seminar series, the Global Evidence for Egypt seminar series, we aim to support the Egyptian government and the NGO sector by sharing evidence-informed insights and ideas that can help to inform the effectiveness of policy design. So this seminar is structured first around a big question. What are the most pressing priorities that the government of Egypt faces, and what's being done now to address those priorities? So today we're so fortunate to be joined by the Ministry of Social Solidarity and the Ministry of Health and Population to outline the most pressing priorities and the new innovations that are taking place to try to strengthen outcomes related to early childhood development. And second, we'll talk about what we as JPAL know about this issue, what we've learned from decades of global research to understand the impact of early childhood development programs and policies, and we'll try to connect those dots to say, how can those lessons be useful here in Egypt? So I'm very glad to have you all here as a part of this dialogue. After we hear from the speakers, we'll be glad to hear from those of you who are here and those who are online to talk a bit further about what some interesting new ideas are. All right, so to give you a bit of background on who we are as JPAL, many of you have already interacted with us as the Abdul Latif Jameel Poverty Action Lab. Our mission is to reduce poverty by ensuring that policy is informed by rigorous evidence. And this seminar series is an important part of that mandate, to disseminate what we have learned with the goal of those insights informing policy and program design by governments and by NGOs. And to that end, we're drawing on, and some of what you'll hear from Karen today comes from this really rich global evidence base. So from JPAL around the world, there are now more than 1,100 impact evaluations on the effectiveness of different development programs and policies, many of which focus on education, on health, and on early childhood development. So the insights that you'll hear today will draw on many of these lessons. Now, as JPAL, we care not only about conducting research and learning things, but about ensuring that those lessons inform policy. And one way of measuring this is the number of people reached by scale-up of effective policies and programs that have been evaluated, and based on that evidence, decisions have been taken to scale. So today, that number is 540 million people, just to give you a sense of the potential influence of evidence-informed policy. Now, at JPAL, conducting this research, we work with a network of more than 260 affiliated professors, of which Karen is one. These are top development economists from around the world who use randomized evaluations together with partners to try to answer questions about what works and why. This is a method that has drawn significant international attention, in part in 2019, when two of JPAL's co-founders, Abhijit Banerjee and Esther Duflo, together with longtime affiliate Michael Kramer, were awarded the Nobel Prize for Economics in recognition of the role of this research in alleviating poverty worldwide. So we're very pleased to share insights from this evidence base with you today and to bring that in dialogue with the global evidence. So next, I'm pleased to introduce some of our opening speakers. So I'd first like to welcome Jeremy Hopkins, the UNICEF representative in Egypt. He began his career with the WFP in Somalia and then moved to UNICEF, where he worked in Somalia, in Mozambique, in South Sudan, and in Burundi prior to coming to Egypt in 2020. So Jeremy, over to you.
Your Excellency, the Minister of Social Solidarity, Jameel Qabbaj, Dr. Wael, Dr. Karen, Dr. Ines and Alison, thank you for having me to speak today, and welcome to everybody. And thanks also for doing it in such a beautiful place. I missed the last one, so this is my first time back here, and I think it's a beautiful location to have such an important discussion. We've been working with, as Alison mentioned, with JPAL for the last 3 years on this Global Evidence for Egypt initiative, which aims to bring policy discussion, existing global evidence to inform national efforts to promote the well-being of children and young people in Egypt. And now with JPAL, we're happy to see how this partnership has grown, and I must say every time I engage, I get super excited and inspired by the conversation and the ideas that flow from this partnership. In UNICEF, we use evidence to drive change. There's no other way to do it, and to identify issues affecting children and to understanding the scale of the problems that we face. Evidence shows us how far we've come in making children happier and safer, and how many are still left behind, and we must never forget that. In early childhood development, I'd really like to congratulate the Minister specifically for her political and strategic leadership in succeeding in expanding the work and investments in early child development, especially the nursery, the work around nurseries, but as we know, there's so much more to it. UNICEF's work on early childhood development supports the tremendous government efforts in the past years and links very well to the two big presidential initiatives that we see as a future for driving early child development, which is Haya Karima and the National Family Development Project. Every child has the right to the best start in life, which paves the way for healthy development and learning. And a poor start does have lifelong consequences, and we should never forget that. Building on the results we have achieved so far, UNICEF, to talk specifically just for a second about our work, has been supporting the development of a comprehensive early childhood development strategy and costed action plan. We are leveraging partnerships for children to make family-friendly policies a national priority and a private sector imperative. Advocating to embed child health, nutrition, safety and responsive caregiving in basic benefit packages for universal, in the rollout of universal health coverage and primary health care, of course. Contributing to the national multi-sectoral coordination mechanisms and the national roadmap for nutrition and early childhood development. Monitoring the quality of program implementation to identify barriers to improving coverage and impact, which is absolutely crucial. We have the building blocks in place. Why are we not at 100% yet? Of course, there are barriers along the way which we have to work on. And of course, institutionalizing and scaling up the implementation of positive parenting, the social and behavior change communication model on parenting, which has enormous, we were just chatting about it before we came in, has enormous potential, is already achieving great results. Let me conclude by saying that we have achieved a lot. We, when I say we, I mean we in Egypt, the government, under government leadership, but with all of us. But there's a lot more to do. The global evidence that we hear about today, together with perhaps local evidence from Egypt that needs to be generated, and I flagged just before we came in the possibility of Impact Lab, which is a sort of related initiative also led by government and JPAL, where we could perhaps look at different domains of early childhood development, such as early stimulation, nutrition, cash transfers, and see how these can be transformed into programs or features of existing programs. And we certainly need to make sure we take from today what we learn and help us propel further action. I look forward to listening to the presentations, the presentation of Dr. Karen and the stimulating discussion that will follow. And I thank you very much. I hope today's discussions contribute. I know they will contribute to the ongoing efforts led by government that is helping to place early childhood development at the top of the economic and political agenda. Thank you very much.
Wonderful. Thank you, Jeremy. Next, I'm pleased to welcome for opening remarks Dr. Wael Abdul Razak, the head of primary health care and the nursing sector at the Ministry of Health and Population. Dr. Wael is a professor of hepatology and gastroenterology at the National Liver Institute at Manufia University and is the head of the primary health care and nursing sector at the ministry. He is also the vice CEO of the National Committee for Control of Viral Hepatitis at the ministry, is a published scholar with over 25 articles in major medical journals around the world. Dr. Wael, over to you.
Thank you very much. Your Excellency, Dr. Naveen Al-Kabbaj, Minister of Social Solidarity, Ms. Alison Fay, Executive Director of the JPAL MENA at AUC, Mr. Jeremy Hopkins, UNICEF representative in Egypt, Dr. Karen, Dr. Ines Hagazi. Dear ladies and gentlemen, it is my great pleasure to convey to you all the greetings of His Excellency, Professor Dr. Khalid Abdel Ghaffar, Minister of Higher Education and Scientific Research, and Acting Minister of Health and Population. It's a great privilege to represent the Minister of Health and Population in this honorable meeting. This series of seminars represent a golden opportunity, as it is conducted through partnership with the policymakers, JPAL MENA region, UNICEF, and participants from various entities and disciplines. This opportunity will allow not only identifying the most important and needed policies regarding ECD, but also measuring the impact of these policies and their continuous improvement accordingly. As you all know, the roles of Minister of Health and Population include improving coverage with integrated child health services, especially preventive, nutritional and mental health services, capacity building of the service providers, and safe and friendly environment, health education and raising awareness of the parents and caregivers regarding early detection of illnesses and needed tools for early childhood development. Ladies and gentlemen, I'm looking forward to hearing today's interventions from all stakeholders to explore the possible areas of improvement in early childhood development. Thank you.
Thank you very much, Dr. Wael. And next, I'm very pleased to have the honor to introduce Her Excellency Naveen Al-Kabaj, the Minister of Social Solidarity. She, of course, brings more than 25 years of experience working on development policies, social protection, child protection, strategic planning, monitoring, and evaluation. Prior to being the minister, she served as an advisor in the ministry from 2015 until 2018, and has also held numerous positions in various development bodies such as UNICEF, the American Development Association, and the American National Council for Women. Your Excellency.
Good afternoon, everybody. It's a great pleasure to be with you today with very deep partners who we're working with, whether the topic or the partners themselves. They are very dear to our hearts and very passionate about discussing the issue of early childhood development. So big thanks to JPAL with all our due respect to research and impact evaluation in Egypt, which we see as very important. And I also welcome my colleague, Dr. Wael Abdelrazek, in the Ministry of Health and Population. And the Ministry of Health and Population actually is a very close partner with us, especially in many issues that we will discuss later. But also Alison, not Alison, Karen. So Dr. Karen, we're very pleased to have you today and welcome to Egypt. I just asked her, she told me that's her first time to Egypt. So we're very pleased to have her and we are sure that we will benefit from your great experience in early childhood development with special emphasis on health issues. And my dear colleague and partner and ex-colleague and friend, Dr. Ines Hijazi, and mostly welcomed Jeremy Hopkins, head of UNICEF, and all dear colleagues. So I think early childhood development falls within Ministry of Social Solidarity mandate under the age of 4 years, and we look at the ECD from different aspects. We look at it from a social protection aspect in order to ensure that all children have the right to join education and to get enrolled in early childhood development and have equal opportunities for being developed with all its aspects, not only education, but health, child development, early detection of disability, early detection of personality problems, working on children attitudes. We mean the upbringing rather than the education. And also we tackle it from a social justice angle in order to ensure that all age categories have the right have their full rights in everything. And one of the age categories that are really sometimes overlooked is the ECD and the elderly people. So out of our social justice, I think that it's very important for us. And the third aspect is it's tackling from an investment in human capital. And we assure that the investment in human capital starts from this age, and we even work at an age with the first 1,000 days in the lives of children, whether with UNICEF or World Food Programme. But we think that at this age, we work a lot on health issues, and it's irreversible. What we lose in this age in terms of self-development, child health, early primary health care for children and mothers. And I combine mothers with children also for breastfeeding, for the type of food that is being fed at homes. And luckily, we just started an impact evaluation exercise with a food bank in order to measure how much nutrition or having the children fed in nurseries differ a lot. And we have experimental group and control group in order to measure the difference between the children who are nourished compared to the other children at large. I think the Egyptian law, the child in the Egyptian constitution, Article 80, identified the child rights that the state has to bear in everything concerning early childhood development, and that every child has the right to an early education in the childhood center till 6 years. So we're speaking about two age categories, 0 to 4 as the responsibility of Ministry of Social Solidarity. And from 4 to 6 is the responsibility of the Ministry of Education. Egyptian child law, according to Article 31, a nursery is any place specified for childcare for children below 4 years. and the nursery has to be supervised by the Ministry of Social Solidarity according to the regulations of this law. And actually we have in Egypt around 16.8 thousand nurses that are licensed and around 10.2 nurses that are not licensed. So if we're speaking about basic licensing of nurses, which is very important in order to ensure that it has the standards that we agree upon of these nurses. And that's why we started easing, facilitating the issue of having the licenses for nurses. And that's why we have a national committee of more than around 12 ministries working on this, not only MOS, but Ministry of Health and Population, Education, Housing, Local Development. I mean, we were too many ministries that were working in order to ensure that the licensing is facilitated as much as we can. And then we started developing actually the standards because we did not have, we have standards, but they were not updated to an extent that would match with the international standards. And that's why we started working on the standards for these ministries and having indicators, a list of checklists. And so we went through two exercises in order to survey all the nurseries in Egypt, especially those under Hayat Karima, because there are villages and there are areas, geographic areas that are nurses free. They don't have nurses. So the issue is that how to be fair enough to these communities in order to have fair distribution of nurses throughout these villages, and especially with the new areas where the people from the slum and unsafe areas were moving to the new areas. We're very keen to have nurses established in order to work a bit on investment in human capital. So I think we have a great disparity of enrollment of children age 0 to 4 in nurses. We nearly have around 8 to 10% only, which is a very minimal, very bad percentage, and we're working on, and the President is very passionate about this, and even from 4 to 6, it's much better than 0 to 4. It reaches around 30%, although our standards a priori, it was 60%, so we have a gap of 50%. So that's why we're increasing the number of nurses, increasing the building up nurses, and also upgrading those nurses that we have and improving their standards. We're also collaborating with the Ministry of Social of Education in order to develop a curriculum for children. And this curriculum is child family centered, and it's focusing on personality development, on nutrition of children, on everything that's related to skills development, working on attitudes, on relations, the relationship with their households, with the communities, with the environment outside. And this is why having a green environment is very important for a ministry. And our actually collaboration is going on with other ministries, because with the Ministry of Health, in order to ensure that we have a health booklet for each child. We're working on it in our child care institutions and also in nurses in order to have a child booklet where we can screen everything that's related to child development, health, cognitive, personality, early detection of disability, and also services for their families. In order to encourage the families to send their children to nurses, because sometimes it's reputed that the children, you know, they got as if they got rid of their children and they send them to the nurses, which is a false awareness of sending children to nurses. And that's why we were working on awareness raising and on actually correcting this attitude and this perception of children. It is early childhood development. So we're encouraging mothers as well with and providing them with services for their reproductive health, family planning, in order to work from a broader perspective, because the less children a family has, the more attention they would give to children. I think also educating mothers on the kind of food, starting from exclusive breastfeeding, and even after exclusive breastfeeding for the first 6 months, breastfeeding up till 2 years, and then the quality of food, and it's not only the quality, the storage of food in the nurseries, because in our visits to the nurseries, it's not that the food is there, it depends on the storage of food, the ventilation in the nursery itself, the children's exposure to green areas. I think this was very important to work on, whether on the standards or in the curriculum itself, and to ensure that children understand what is environment, the relationship to the environment, to the community, their perception towards a child who is disabled. And this is why we're working a bit on integration of children with disability in any nursery. Before I leave, I would like to shed the light on psychological health and psychosocial support for some children. I visited more than one nursery, and some of them in northern Sinai, and I actually recognized and I felt it on the spot how much the children can change and can improve the psyche of children, whether those who are orphaned or those who are exposed, who were exposed to heart conditions, or even those who have some sort of learning difficulty, and how much they could be bullied if this was not detected at an early stage. And that's why, or even the children who have personality disorders, because I think stereotyping these children and upbringing them in an environment that does not actually understand them quite well is very important. I think the preparation and the training of teachers and of the nurseries management, it's because the management at the end, those who take the decisions, so the training of the nurseries management, of the social workers, of those in the kitchens, training them on hygiene, on cleanliness, on healthy food, on what to. It's very easy to find the children eating biscuits and chipsy and so on in nurseries, which is very bad, and which is actually, when you go to the kitchen, not necessarily even the chefs and the kitchen follows the right rules for health. So I think also having a doctor, not all of the ministries have doctors in the ministries or on the ministries, the nurses themselves, and that's why they have a visiting doctor, even if they do have visiting doctors, to ensure that this doctor is multi. That we ensure that we have all types of detection that we can monitor and that we can survey, and in the meantime, to the frequency of visiting the nurses, how much we have. I think the first 1,000 days in the lives of children and up till the age of 4 is a very important stage for us. And that's why in 2017, in the conditional cash transfer, we increased the amount. The children under 6 were not included before in the CCT, in the conditional cash transfer. It started at the age of 6 years and up till 18 years for education and for having health cards. And then we increased the children under 6, 0 to 6, and then we went a bit before till the lactating and pregnant mothers. So now we're improving, alhamdulillah. So we're getting along with all stages, and we're increasing the number of nurses in Egypt. We're aiming to reach the number of 35,000 nurses. We're promoting big factories and private sector and companies to have nurses in order to ensure that working mothers can feed their children and can be closely attached to their children, even for quite little bit of a time during their working day, which is good not only for ECD, but for economy and for working mothers. I think finally, we are adopting positive parenting. We're partnering with UNICEF for that purpose, in order to ensure that we have positive attitude, stopping violence against children, disciplining children in a constructive manner, and working with teachers, social workers, mothers at homes, community members, community workers, which is الرائدات المجتمعيات, and we're having the voices of children heard through a shadow report. We're working in our human rights training in order to listen to children. It's very important to advocate for their rights, but to advocate with them on their rights and to listen to them as well. So I think even if they are very young to express their views, but I think having them participating and included, even with their plays, with whatever, is very important. And we are working also with JICA in order to develop learning through playing, because for every child, he or she have the right to play and have the right to, I won't say to read at that age of 0 to 4, because actually all of the people became a bit maniatic about preparing the child to join nursery from age 4 to 6 and to be accepted in schools. So they keep boosting the child with lots of info, and they forgot everything about the skills, the attitudes, the development, because they have to succeed in order to get enrolled in schools. Because this is not fair to children. So if this is the case, then we have to promote with the Ministry of Education. So I think it's a long way to go, but I'm happy that we tackle it from a comprehensive vision, and we tackle it not as must, but as partners in development. And that's why we have the Ministry of Health, Social Solidarity, Education, Research, Institute, or JPAL, UNICEF, NGOs, but I think also including families with us is very important, and educating communities about the rights of children in accordance with the Egypt strategy for human rights is highly appreciated. I have the pleasure to be with you today, and I owe you because I'm the one who delayed a bit the start of the session. So if you have anything, I can pay. So, so thank you very much, and I have the pleasure to be with you today.
Your Excellency, thank you very much for those remarks. Now, having heard a bit from the Ministry of Social Solidarity, from the Ministry of Health and Population, I am pleased next to introduce Dr. Karen McCour, a professor at the Paris School of Economics and the co-chair of JPAL's health sector. She is also a researcher at INRA, and her current research focuses on conditional cash transfer programs, early childhood development, rural poverty, and agriculture. Karen earned her PhD from the University of California, Berkeley. Karen, we're excited to hear from you about the global evidence next.
Okay, wonderful. Thank you so much, Your Excellency. Thanks for being with us, Dr. Wahl, Dr. Ines. Very happy to be here. Can you hear me well? Yes, great. So what I'm going to try to do is share with you a little bit about what we know from the global evidence based on the important topics that the Ministry has lined out for us already. And we'll start a little bit with some basic statistics on what we know about ECD in Egypt, also what we don't know. Then talk about the existing evidence from randomized control trials. But before getting into the evidence, kind of just explain a little bit kind of the conceptual idea of those randomized control trials, then look at the evidence across different domains relevant for early childhood development, and then we'll conclude. So, why invest in early childhood development? Let me make sure that, can you hear me well if I speak, if I'm standing this way? Yes, great. So, I mean, this is kind of a question that almost doesn't need an answer in this audience, but let me anyway kind of give the big picture answer here, which is that there is many different reasons, both, you know, if you want to almost neurological, biological, nutritional, and psychosocial, to believe that investments very early on in life have very high payoff. That's true because of the basic science, but also it's true based on the evidence that we have. When we follow those children, once they leave early childhood, they start schooling, but also when we follow them longer, all the way to the labor market and to their adult lives. So what that means is basically the very early years in life, and whether we define that as the first 1,000 days, or whether we define that 0 to 4 or 0 to 5, are a unique opportunity because the skills that are built at that point become generators of additional skills, or facilitate, you have a multiplier effect. And of course, that's kind of the exciting reason to do so. Now, why is JPAL particularly interested in this topic is kind of, if we're thinking of poverty reduction, kind of if we think of those early constraints to cognitive and socio-emotional development as permanent constraints potentially if you don't address them, then that also means that this initial window in life is a very potential powerful window to intervene in. So, as I said, before going into the evidence, it's worth taking stock of what we know about from the statistics, from the hard data, if you want to, on early childhood development, and in particular on the development, the potential delays in development potential in Egypt. So no, we don't yet have in Egypt, as far as I know, national representative data on some of the more kind of cognitive, socio-emotional outcomes very early on in life. I was excited to hear in the discussion just before that the new DHS will have some of those indicators which will allow to kind of take stock of that. What we do know, however, and that's also important, is data, what we have is data on kind of mortality, morbidity, nutritional outcomes, and including micronutrient deficiencies of children 0 to 5. We know there has been tremendous progress in the country in those indicators, but we also know that there is more gains to be had. So for instance, if you think of nutrition, there is still more than 2 million children stunted, so that's with hampering growth. And that's not, that's stunted, so that's too low a growth, but in addition there is obese children, etc. There is also a large percentage that is anemic, and being anemic then means being more vulnerable for different diseases, etc. So we know there is more work to be done, and that's particularly true in the current context, or we can think that's particularly true given the concerns on food availability, given the international crisis that is going on. Some of those risk factors are going to be even more important, so very timely to have this discussion today. Now, what we know then about the mechanisms or the type of interventions and environment in Egypt that affects children early in life, there also we have reasons to believe there is more work to be done in terms of the policy. Now, when we think of children very early on in life, 0 to 4, the natural entry point is about families. And indeed, when we want interventions to be effective, ultimately, we're going to want to have changes in parental investment in children very early on in life. Of course, when we think of those ages, we often think of the mothers first. But when you look at Egypt, it's actually interesting and important to realize that also on this dimension, the gender inequalities are large. Fathers are investing much less, and potentially an important opportunity there. And we know this from other countries that once you that may be a low-hanging fruit involving fathers more in stimulation of children as a way of engaging stimulation. The ministry already talked about the center-based part of things. So the statistics show that only 8% of children 0 to 4 are enrolled in childcare. So kind of a large potential to increase. And then another risk factor, potentially very important, is what is called here home safety, more general, kind of a safe environment at home, whether that's related to disciplining or even worse than that, violence. And so almost 1.3 children, 1 out of 2 children under 5 has been hit or has been exposed to violence in Egypt. So that's an enormous share and a suggestion that much more work is needed there. So why thinking of RCTs in this context? So as I said, kind of when we think of early childhood, we think of parental investment first and foremost, but most of the time that very young children spend is with their parents or with their caregivers, parents in a broad sense. If you want to change the behavior of those parents, then we know that changing behavior is a challenging thing to do. We can give them information, we can provide means, we can give conditional cash transfers, but then the real question is, how do parents respond to that? And we know people live in complex environments, and the behavioral responses are not always very predictable. So this is exactly the type of reason where we kind of context where we say we need good evidence of this. We need to test this rigorously, because possibly parents may react differently than what we expect, and we should test this before we scale. So why then use randomized controlled trials? So kind of just in a few slides, imagine we have a population of let's say, children 0 to 4 in Egypt, and some of those children live in slightly richer households, some of them in poorer, so imagine the colors are kind of different socioeconomic backgrounds. Some of them also, may be already more delayed, some of them are stunted, as we saw, there is existing variation. Now, if we're going to do an intervention, what we'd like to do is say, so what we ideally would like to do is kind of, just let me go back, is kind of do an intervention, look at the same child before the intervention, and do the intervention, look again, and then imagine what would have happened with that child without the intervention. Now, if we were biologists, or if we were chemists, and we would clone children, and we would do one with the intervention and one without, obviously that's not what we can do in social sciences. And so what are we going to do instead is we're going to make sure that we have two groups that are comparable, because we designed them to be comparable. We start from a large population, and then we randomly will allocate one to a group that will get the intervention, and the other ones that don't. As you notice on the slides, they look similar on average, because we have equal numbers of different socioeconomic gradients on both sides. So if we do that, and if we then compare the outcomes, let's say we will measure the cognitive outcomes of those children after an early childhood program, if we see that the ones that got the intervention are doing better on the outcome, or have a certain level of the outcome of interest, but we also know what happened with the group that didn't get the intervention, then we are pretty sure that we've controlled for that heterogeneity, we have the individual characteristics taken care of, and the difference will be because of the program. So now we can make a causal statement about the impact of the program without needing to doubt whether it was because some households were richer and some households were better prepared. So the evidence I'm going to share with you is evidence from across the globe that uses that method to look at different types of interventions targeting children from 0 to 5. And so I'm going to, so that's going to be evidence in, if you want to, 4 major domains that affect early childhood cognitive and socio-emotional development. And so when I say socio-emotional development, that includes kind of the personality development that the ministry was talking about. So we'll talk about interventions trying to do stimulation, to help very much focus on cognitive development, but also interventions focused on nutrition, on preventive health, and then the home environment, including the safe environment, the questions on disciplining, violence, etc. And then at the end, I'm going to talk about conditional cash transfer programs. I was excited to hear the ministry tell about the changes in the current program, and I will share some evidence globally that actually directly speaks, that confirms we made the right decision by including the below 6. Okay, so on the stimulation side, so what do we mean with early childhood stimulation? So it is interventions that show and teach and inform parents about the importance of play, the importance of conversation, reading, and songs with their children. And so this is something where we actually have a very exciting body of evidence from a number of different countries, so 17 studies in 11 different countries across the globe, where systematically those studies show that if you show parents how to stimulate their children through play, through songs, through communication, that improves not just that the parents learn that and change their behavior, but most importantly, that leads to gains in the cognitive and the socio-emotional outcomes of those children. Also, in most cases where we have been able to look at the differences, and maybe not surprisingly, the gains are the biggest among the most disadvantaged. So the children that were stunted to begin with, the children that were from poorer households, etc. And you see here, this is evidence from literally from across the globe, from Latin America, over Africa, and all the way to China. So the most kind of famous, and we talked a little bit about this before the session, the most famous evidence of this is a program that started in Jamaica, in fact, more than 30 years ago, where Dr. Sally Grantham McGregor, who is a pediatrician, identified a new approach, a home visiting program, showing parents or parents of stunted children how to interact with their children. She showed, with her colleagues in Jamaica, that on the short run, this indeed led to cognitive outcomes and to socio-emotional outcomes. But importantly, 20 years later, and teaming up with a number of economists, they then showed that this intervention 20 years later indeed had led to better schooling, by more than half a year of schooling, that 20 years later those children were still doing better in terms of cognitive achievement tests, and most importantly had higher earnings as adults by the age of, by 25%. So this is a really big impact. 30 years later, the intervention had an even greater impact. So they kept on following those children across the globe, because some of them moved out of Jamaica. And so find now that this still leads, by the time those children are more than 30 years old, wages increasing by more than 43%, and adult earnings by 37%. So this study shows the potential, shows that this is possible, we can do this, and it makes a big difference. Of course, well, this was a relatively small-scale study, and so then the question is, wait, I need to look at the piano. No, I skipped something? No, there we are. The question then is, how do we scale this? And so there has been many attempts of scaling, including by thinking through the incentives of the home visitors, the building on the local infrastructure, whether that's the community health workers or the existing conditional cash transfer program infrastructures in Colombia. And so the evidence there shows that you can get not just changes in the final outcomes, but also in knowledge and in parental behavior. So that's one approach that works, where scaling is still, we're trying to figure out how to scale. The second thing where we know is that, of course, nutrition matters for early childhood. That kind of almost needs no explanation. But what we, and again, there is, of course, lots of literature in the medical and the nutrition science on this. But one of the things that we need to figure out when we do this at scale is, how do we incentivize parents to make the right investments, and what does it take to do that? So we know, for instance, that when you try to nudge parents, or you give them information, or you remind them of information, that sometimes that works. So for instance, in Zambia, reminders about nutritional quality has reduced stunting quite substantially. But in other cases, like in China or in Ethiopia, it was less successful. Similarly, or relatedly, when interventions that specifically target specific micronutrients, the evidence is also very mixed. In fact, the evidence from Colombia here is it's the same population, the same experiment where they scaled the early childhood stimulation. The stimulation had an impact, and micronutrients didn't. And so it's not, that is not to say that the micronutrients are not important. We know this from the medical literature, but scaling it and making it to a certain extent that the intensity, the exposure is big enough, has proved complicated on its own, like doing this on its own. Preventive healthcare, so there again, there is an existing literature. As economists, kind of what we can bring to the table here, and what JPL Research has tried to do, is to think about how do we increase take-up. And so we know, for instance, that for vaccination, simple incentives, small incentives, this is childhood vaccination in India, made a big difference. We also know, when we talk about healthcare, and I don't think that needs an explanation in this audience, is that the health workers themselves are key, and their incentives, their contributions are important. So thinking through how do we design, for instance, performance pay, incentives pay is important. There's a mixed evidence on that, lots of things to learn from. So let me kind of, in the last part of my presentation, talk about conditional cash transfer programs, which is not only very important in the country here, it's also a topic close to my heart. And it is, the reason to talk about it here is because ultimately when we do CCTs focused on and including the targeting on early childhood, we arguably can address the different domains that we talked about: nutrition, preventive health, stimulation, and the home environment at once, because it allows to relax different constraints by using information, conditionalities, and liquidity constraints. So there also the global evidence base is relatively large. Now, a lot of the CCTs, of course, have the evidence base is related to education, but we also have quite a large evidence base now on conditional cash transfer programs focused on early childhood investments, whether that's nutrition or health conditions or growth monitoring conditions. So if you look at, so evidence from 13 countries across the world show that indeed not only CCTs are effective in increasing the uptake of preventive health care, the growth monitoring, etc. They're also effective in increasing the dietary quality of children. So if you give the CCTs and you tell parents investing in more diverse diets matters, parents are the soft conditionality helps. Okay? So we know that on the short term they improve health behaviors. They also can help improve vaccination rates. But then and we know that subsequently has led to improvements in schooling and reduction in stunting. No more, possibly even more exciting is that we also know that on the long term this pays off. And so the conditional cash transfer programs, the first ones were designed in 1997. So we know, have a long enough time for the first countries to show us what happened. So in Mexico, we went back 20 years after the original Progressa CCT, so the first global model of a program that did this nationally. And so there we know that on the short term, the program reduced anemia, reduced stunting. 10 years later, we knew it improved in particular socio-emotional outcomes of the children that had benefited. And 20 years later, so by the time those children are finishing university, are starting the labor market, we showed by kind of finding them back wherever they were, that they indeed had gotten more education. So the education, the early childhood health, nutrition translated in better education, and that those children are expecting higher incomes. And so this now is evidence of a national program of a middle-income country that shows that those early investments not only are important in and of themselves, but also pay off much later, and indeed pay off at least as well as the educational investments, because in that study we can do the comparison of the two. We also know that the timing matters. So evidence from Nicaragua, so a bit of a polar setting, of course, shows that kind of the earlier, the evidence that very early transfers led to permanent changes in cognition, and that wasn't necessarily true for transfers a little bit later. So let me conclude there. Oops, I went a little bit too quickly there. So let me conclude with kind of the big takeaways here. So first of all, we know, and we have good reasons to believe, that encouraging parents, caregivers, but also communities at large to engage, to stimulate their children can have large payoffs. And we are, there is evidence from across the globe that matters in particular for the cognitive development and for the socio-emotional development of those children. We know that nutrition is a key input into early childhood. There is no question about that. The evidence shows that when you do nutrition interventions on their own, they don't always lead to long-term results. They are mixed. That's maybe not surprisingly, because as I said, there is in a certain way 4 risk factors, and so addressing only one of them at a time may not always work. On preventive health care, so improving them obviously can help reduce nutrition. There's a lot of learning there in how to do that. And finally, conditional cash transfers have a potential important role to play in this space, exactly because they address multiple risk factors at once, right? And so the mental health was mentioned earlier also by one of the speakers. That's another kind of one. If you reduce the liquidity constraints of the households, if they have a social safety net, the mothers may have, maybe more relaxed, less stressed, and that itself also, again, there is other evidence that shows that may have a multiplier effect. And so by having these different risk factors addressed, there's a particular potential for the long-term outcomes. And so let me stop there. Thank you.
Wonderful. Thank you, Karen, very much for that extensive overview of the global evidence. I think it's exciting to learn that there is so much evidence behind these kinds of investments, that there's tremendous potential for the long term, like in a generation, impacts that we can hope to see. And in particular, the evidence that in some instances we're seeing that it's the most disadvantaged children who are actually responding with the largest impacts to some of these programs. But it's also very interesting to hear from Karen that it's important to get the design and the delivery kind of details of these programs right. So I'm very excited now to transition our conversation to the panel discussion. And so we'll hear from each of our speakers with some reactions to some of what Karen has shared. And I'll get us started with some questions for each of the panelists. So first, I'm pleased to turn it over to our first panelist, Dr. Ines Higazi, the Early Childhood Development Manager at the Egypt UNICEF Country Office. She is recognized for her expertise in policy development and advocacy and sector-wide reforms on promoting the rights of children as established under the CRC and other international frameworks. She has worked on designing and implementing innovative models for early childhood development and inclusive educational programs to reach some of the hardest to reach children, to strengthen government programs, policies, and systems. She has a master's and a doctoral degree in human resource development and performance improvement from Manchester University and Capella University. And prior to joining UNICEF, she worked at CETA as a senior education advisor. Dr. Ines, I'm pleased to turn it over to you for your remarks, and then we'll get started with questions.
Thank you, Alison. Your Excellency, Dr. Wael, and Dr. Karen, thank you so much for the rich presentation. In fact, child development is an integrated process that requires integrated packages of interventions to address. The four key takeaways that we concluded from the presentation actually represents the nurturing care framework, which is a framework that is evidence-based and has been launched by UNICEF, WHO, and the World Bank in 2018. It includes all elements required for child development, including early stimulation, good health, adequate nutrition, care, protection. And what is needed actually from that is how can we develop our policies and programs and interventions in order to address all the needs of the children, not only one specific area or one sector-specific need. What to invest in and why is an important question that we still need to address. The research has shown many elements of interventions. However, integrating those elements would provide us with more added value to the child development. So if we only give nutrition, work only on nutrition, separately from early stimulation, that will not give us the same results on child development as we integrate both. What other interventions that we need to work on and integrate on our ongoing program would require further research, particularly at the local level here in Egypt. Two things that also I want to highlight, again they were mentioned in the presentation, but I want to highlight them further, is the theory of change. our programs, our research has showed that programs that do have a clear theory of change that has been shared with the beneficiaries and with the providers provides better results for child development. And also the investment in the workforce. And investment here in workforce does not only stop at providing training or awareness, but also providing post-training performance support in terms of proper supervising and proper feedback on performance to maintain and sustain the results of the training provided. So these are also two elements that we would need very much in planning our programs and in providing interventions that would strengthen the capacity of our existing systems to provide integrated early childhood development. Thank you.
Great, thank you. I have a quick follow-up question. I wonder if you could tell us a bit about how UNICEF in particular is supporting these national efforts to promote early childhood development and how you're helping with this integration priority that you've identified.
Well, in fact, UNICEF is working on a variety of models to support early childhood development in Egypt. First of all, we are working on supporting the coordination, multi-sectoral coordination among different sectors to create an enabling environment for integration of different interventions on ECD. In that respect, we supported the government in developing a national strategy for early childhood development, together with an action plan, a costed action plan, and this activity was led by the National Council for Childhood and Motherhood, and all relevant ministries and entities and national councils were involved in the process, so that was a great exercise to bring together all the key players in early childhood development to work together to develop a common vision and a common strategy and plan. And secondly, we worked also on developing the national early learning and development standards for children. Definitely every sector do have their own standards, either for the service provision or for the child development, but we still do not have common national standards that have been approved by all different sectors as the early learning and development national standards for children. Agreeing on the end result together across all sectors will definitely help creating the same vision, same target, and will enhance the coordination capacities. And also we have a national committee for ECD policies in Egypt that UNICEF is supporting, and again it's chaired by the National Council for Childhood and Motherhood. Secondly, we do capacity building for the workforce, whether for professional service providers, particularly in nurseries, and also for the parents through parenting programs. Also, we are working in integrating new programs into, or new activities into ongoing programs or existing platforms that they are going. And we have a number of examples that we have started working here in Egypt together with the government that we could evaluate, learn from, and then take to scale. Some of these examples are in the health units, taking health as an entry point. We have added, together with the Ministry of Health in healthcare centers, early childhood development corners, where mothers can learn a lot on how to stimulate their children and how their children can learn and develop through play. Through the conditional cash transfer, we had also added the component on parenting education, positive parenting, and nutrition. Through the early stimulation and through the nurseries as a platform, we have also integrated nutrition through educational kitchens in nurseries, and also health through early detection and early intervention for children with developmental delays. And also even for parents, for increasing their income, and for them to invest in their children. We are working also with the Federation for Egyptian Industry and the ILO on adding the component of child care and working on advocacy with the private sector for child care supported by employers to enhance child development as well as to have women economic empowerment. So these are more or less some of the interventions that UNICEF started to bridge the gap between research and practice. We're trying to practice the integration of interventions for ECD, and we are looking forward for an upcoming impact evaluation that we will jointly be doing with JPAL and with other partners, led by the Ministry of Social Solidarity, and for 500 nurseries with an integrated program that we will implement, and then we will evaluate the result for learning and for correcting the programs and scaling up. Thank you.
Excellent, thank you. You addressed really nicely at the end there what was going to be my follow-up question, which is around so many of these areas that UNICEF is involved in working with government partners on. Where do you think some of the innovations are that you would love to see more evidence around? So that final list around what's really the impact of the ECD corners for mothers, what's the impact of positive parenting and nutrition, what happens when we introduce educational kitchens and nurseries. These are all interesting questions that I think build on some of the evidence that we heard from Karen, but where potentially the policies that are being introduced in the programs here in Egypt are going beyond things that we know the answers to. So these could be very interesting candidates for evaluation, but I'll give you a chance if there was one or two big impact evaluations in addition to the nurseries, one that you're already working on, where would you love to see more evidence in this sector to help guide UNICEF's investments or to help UNICEF give the kind of policy advice that you offer as well?
I think assessing the impact on the children is key. And that's what we have not yet done as much as we should. A lot of the assessments and evaluations that we have done were mainly on the provision of the service. How good the service is, how good the inputs are, how good the activities are. But then assessing the impact on the child, I think that is the key, and that's why we are doing all these interventions. I just want to say that all the packages that UNICEF is working with the government are all evidence-based packages that have been developed. Some of them were launched globally and have been adapted to the Egyptian context. But they are all evidence-based, saying that these are the interventions and that's how they are being used, provide, according to research, the best results for children. It's important that when we start implementing that in Egypt, that we assess it in the Egyptian context to see whether, yes, what else needs in terms of adaptation to really realize that. So some of these packages are the parenting, positive parenting packages that is led by the Ministry of Social Solidarity, the Care for Child Development that is being implemented by the Ministry of Health. We have also Care for Caregivers, that's another program that has been built based on evidence also for caring for caregivers. So we have packages that are being implemented, tested, researched, and we are trying to mainstream that here in Egypt. Thank you.
Great, thank you very much, Dr. Ines. Next, I'd like to turn the floor to Dr. Wael, who will share a bit on the Ministry of Health and Population's efforts related to early childhood development, and we'll follow up with a few questions.
Thank you. I think we have a very great privilege because we have mega data from all the presidential initiatives that were done in the previous years. We have more than 12 initiatives. Some of them are directed to the mothers and children. So we have plenty of data. We can analyze this data and draw health maps with specific social geographic needs and direct our efforts to those needs accordingly. Planning for unification of national guidelines in collaboration between the Minister of Health and Population, the Minister of Higher Education and Research and Scientific Research, including those regarding women's and child's health. Making use of social media platforms, for example, using the Facebook page of 1,000 days, first 1,000 days, which are the golden days in the child's life. The preparation of all health facilities to the universal health insurance system in the upcoming years, through not only capacity building of infrastructure, but also training of the personnel and through health digitization. We are using medical convoys to reach the disadvantaged areas with the highest needs. We have the mega project of Decent Life, Hayya Karima, with a 360 degrees approach for all life aspects in all disadvantaged areas. The project of development of the Egyptian family health, with a positive approach to the family planning program, through focusing on the rights of children and mothers, to have a decent quality of life and well-being, a system of conditionality, as Dr. Karen mentioned, to link cash transfer to the utilization of healthcare services, with points of different weights to every intervention, according to the importance and impact of each intervention. Support with training to start small and minimal projects to improve their income. All this in the same building. So I think it's a comprehensive approach in this project. This is, in short, what we are doing right now, and what we are planning in the upcoming days.
Great, thanks very much. And Dr. Wael, it would be great if you could elaborate a little bit more on your perspective on some of the challenges that in particular are posed and exist that are influencing young children's health outcomes in Egypt, that many of these programs are designed to address. And again, if there are places where you think it would be beneficial to have some evidence on the impact of some of these solutions that you've just laid out, and how they might address some of those challenges and improve health outcomes.
I think the question of challenges is an excellent question, always. We have the lack of awareness. This is our main challenge. How we address it now, we are using different ways to reach different socio-economic levels of society, making the best use of community health workers, TV, radio, social media, everything. We need to fulfill all visits of early childhood, under 5, I'm talking about under 5 children, especially after the end of the vaccination, because every visit for vaccination is a is fulfilled. We have an excellent vaccination program with an excellent coverage, even all across the globe. So till 1.5 years of age, we have an excellent coverage. We have excellent fulfillment of visits. But afterwards, maybe the visits decrease. We should illustrate the importance of those visits after the end of the vaccination. We need to reform and integrate child health services with augmentation of services. For example, we added vitamin A supplementation after the age of 1.5 years to encourage families to come to have a free supplementation and to add other services to this visit. Adding kids areas to the PHC facilities, which encourage families to come with their children. Education kitchen for safe, healthy, and on top of that, economic options. We are in need for under 5 surveillance program, mortality surveillance program. We are currently working with the UNICEF to develop a system for this, as we have a success story in the mortality surveillance program with an automated solution. Automation and integration with the different governmental services, addressed through revision and integration of all paper phones and the transformation into digital systems. We have the privilege of the national ID. But however, in the first 2 months, we are out of this privilege, according to the Egyptian law. So we designed a unique identifier to be replaced once the national ID is there. Integration with the different digital systems then in the Ministry of Health and Population at first, then with the other governmental services. Malnutrition, especially the need for micronutrients, if we are talking about hidden hunger. How we addressed it through screening for malnutrition, hereditary and metabolic diseases, and developmental milestones. Making vitamin A, folic acid, and iron available for free, sure. The partnership with the Ministry of Supply and Internal Trade, the UNICEF and the WFP, to fortify flour with iron to act against anemia. The equity of health coverage, the MOHP and MIS most addressed the need for follow-up visits for children in orphanages, to supply them with the presidential initiatives, the health services of this particular age, screening, preventive services, nutritional and mental health assessments, and linkage to care if needed. The educational kitchen, especially for patients with special needs, to ensure equity of this subgroup.
Great, thank you. So, of course, the Ministry of Health and Population has a massive role to play when we're thinking about these issues. And something that strikes me is just how comprehensive and numerous the many initiatives and programs are that you've just laid out. I wonder if you could talk a bit about, especially in the efforts to try to reach those who are in more isolated or more rural communities, how the Ministry of Health and Population, linked to some of the major initiatives like Haya Karima, is expanding the reach of many of these programs and services, and what increasing service delivery in some of those parts of the country entails.
As I mentioned, Haya Karima is a 360-degree solution. It integrates all the ministries, all the efforts of the government of Egypt, sure with the other partners. It's not only the Ministry of Health and Population, it's everything in the disadvantaged areas. We can add to this another layer of the national health, family health program. If we add it to the conditionality of healthcare services and conditionality of the attendance of schools, I think we can give a comprehensive approach to these areas. This is what I can add to this.
Great, thank you very much, Dr. Wahab. And finally, for our panelists, I'd like to turn the floor over to Her Excellency Naveen Al-Kabbaj. First, inviting if you have any questions or comments in response to the global evidence that Karen has shared or the interventions of our other panelists. And otherwise, if you'd like to elaborate further on some of the areas that MOS is making major investments in early childhood development that you're especially excited about. Over to you for a few minutes.
Thank you very much, and special thanks to Dr. Karen for her insightful and inclusive presentation. That was of great benefit, added to other impact evaluations that you're doing. I think it gives us a full picture about the whole situation, and I'm just comparing it to our impact assessment that we did for the Takaful program. We had an impact evaluation that was evaluated by IFPRI using a mixed method approach through two complementary studies. One of them was quantitative with a sample more than 6,000 households, and the other one was qualitative where we used in-depth questions asking to fewer households in longer term. I think the quantitative methods gave us lots of insights. The first of which was the careful increased the value of household consumption for beneficiaries by 8.4 compared to the household who did not receive the cash transfer. And we are more focused on all households, but specifically on impoverished households or those who have special needs. And this result compares, compared well, even in relevance with other countries like Brazil, like Mexico and Honduras. And also the children or the households who received the careful program increased their food consumption and improved the quality of their diets, especially consuming more fruits and poultry. And this was actually one of the findings of the quantitative evaluation, which proved that the more families have more cash, the more they spend on food, especially with the food prices having higher food prices and less economic level of the households, which would entail less spending on food. And it's realized also that one of the household surveys that we did, that people started to spend more on education and less on food. Food spending for beneficiary households is nearly 9% higher than non-beneficiary households. Coming back also to the qualitative evaluation that confirms that households use transfers for food purchases and shows similar pattern among ultra-poor and threshold households. And when we compare it to the quantitative, we find that both findings are very relevant together. It's not only the nutrition, because during our evaluation, we weighed the children. So there's a careful increased weight for height, Z-scores, which measures short-term nutritional status for children under 2 years, and this is according to the quantitative evaluation. And also it measured considerably lower rates of stunting and wasting than past estimates, which proves actually, and which goes in accordance to what Karen has realized and came with in the research. Poor households also spend large amounts of transfer on private medical care. We're expanding in our health insurance, and we're expanding on the state is spending lots of money on improving health services, but still the villages have a bit of shortage in health services, especially for children or for pregnant mothers. That's now is being tackled under Hayat Karima, with the Ministry of Health expanding its health services. But I mean, people mostly refer sometimes to private medical care, and that's what we're working on currently, is to expand government healthcare and expand the doctors being there. Qualitative evaluation showed that public healthcare services are also used, but I mean, it's different between one village to another, and it depends on the availability of services. So coming back to what Karen has tackled, and I would like to put it in a bigger context, because I mean, if we're studying children, we should also tackle the households, number of children per household, and also the house characteristics. I mean, how many children are found in the share of each child in the space of the room, the ventilation and the space where the child exists. I think the education of parents is very important, and this is quite felt that the poorer the poorest the families, the less educated they are. And it's not only reading and writing, because around approaching 60% of the mothers, of the old mothers of the careful, are illiterate. And that's why we're tackling the mothers between the age of 18 to 35 or 15 to 35 in order to ensure that the coming generations are being well educated and quite aware of the good practices of health, hygiene, and nutrition. Availability of water and sanitation is very important as well, because now we're expanding a lot. I mean, most of Hayat Karima goes for water and sanitation, because sanitation is very costly, but definitely it affects the children's health and well-being, children being affected with diarrhea and so on. So I think having water and sanitation, and if these households receive ration cards and school meals, unfortunately children in nurseries, they do not receive nursery meals, although we consider that this is even more important than having them مثلا in preparatory or secondary. And we wish to give everybody, and that's why the government is expanding in school meals. Instead of investing in 1.1 billion, now it's 6 billion in even, 6 billion, or it was 8 and then now it's 6 billion. So it's multiplied by 6 times, but it's for schools. Now we want to focus as a ministry on nurseries, and that's why we're trying to make a case through the impact evaluation that we're doing with the food bank, because we're choosing a number of schools to make a case that if children receive well nutrition at a very early stage, especially if those children are also breastfed, how much difference it does into cognitive development, into child development, and even in economic aspect. And I concur actually what you've just mentioned about the longer term impact on economy at large, because it's not luxurious. The issue is that sometimes government measure it by the cost, but not the benefit. So we have to measure it cost, relate or benefit, irrelevant to the cost. I think also, especially if that, and again I repeat that the school meals have to be monitored. It's fortified minerals and so on, but also decreasing or reducing the use of sugar, drinking water. I mean, health is not only food. It's environment, it's ecosystem of even the children. It depends on the place they play with, the green environment, playing sports, drinking water. I think, and that's why I'm speaking about dietary quality. The storage system for food is very important. Not all of the nurseries are quite aware of this. The expiry dates of the food, especially if it's packed. Hygiene process in the nursery, even using insecticides. I'm reverting back to the standards, because now we just finished the surveying of Hayat Karima villages according to our new standards, in which we included everything. So we will come out with the results very soon, And it's very interesting, the results, because even using insecticides and using some of the chemicals there for hygiene chemicals have to be monitored. Health checkup is very important, and I agree with Dr. Wael that we realize, and it's very clear that there is a shift in quality of health coverage and also health checkup for children. And when the lady, because we have conditional cash transfer, but unfortunately, we started with it and then COVID-19 came, but it's not having, I mean, show me the booklet in order to see what's written in it and to monitor the child growth. I think tracking illness, especially if we are tracking certain illness that are relevant to certain geographic areas. Like مثلا in Fayoum, we have low level of iodine. Then it needs to have tailored package. For example, in the frontier governorates, we have less usage of water. So I think we should tailor a bit according to the tracking the probability of illness and the health environmental conditions, and accordingly to tailor some of the services that are relevant for children. I think we also need to look at the nurseries for children with disabilities, whether it's completely dedicated for disabilities or it's integrated with them. Because, I mean, we are very short in them in Egypt. If the child learns to read lip language, they might not need shadow teachers. But unfortunately, because we supported children, young people to join education, but to join universities. But when they came to join universities, we found that they're very, very poor in language and in writing and reading, because they did not receive well education. And the hard of hearing nurses are very limited in Egypt. We have in our ministry, and actually one of the NGOs came and told me, I want to have one of your, Magda, I want to have one of your nurses in Luxor. So I told her, okay, we have too close to each other, we will keep one and you take one. She told me, I will charge 700 pounds a month. So I told her, la, this is too much. I mean, we offer it for free. So it's like, you offer it for free and then you ask for each session and so on. So I told her, خلاص, have the luxury of doing it and then let's see the results. And then she charged 600 instead of 700, and we agreed. خلاص, we gave her the nursery, and we found out that her nursery is fully booked and they have a waiting list. And our nursery, it only has 3 to 4 children. Too transparent, huh? But I mean, we should not, as a ministry, it's because at the end of the day, we're choosing NGOs. We're not implementing by ourselves. But this means, I told them, this means we have to revise all of the NGOs that we are working with, because sometimes we think that the community suffer from specific problems, but the issue is that when we surveyed, she told me, خلاص, let me charge 600 if the children are poor, you support the children. But let us have the same standard for the nursery. And then we became back to give her money. She reached out لغاية دلوقتي 5 nurseries, and she needs more too. And we had it one in Ismailia, one in Luxor, one in, because, and this is very important also, whom are you working with? Because we can have a wonderful theory, and I agree that, but we need to know, but then to walk the talk. In order to walk the talk, we cannot do it ourselves as government. And that's why we're opting for strong NGOs to monitor this. And I come back to another point on the awareness. Because I met one of the colleagues who's working actually in a key position, and she told me, the children in the villages, they don't need to go to the nurseries. They can go to their grandmother. What will they do? The nurses there are very poor. So I told her, let's improve the nurseries. Yani instead of going to their grandmothers, it's very nice and very healthy. But I mean, for a certain period of time during the day. But I mean, all of their ECD is another house. I mean, this is yani. So I think it's a combination of different aspects together, and that's why. And it's mostly not only health, but it's actually economic, and that's why we opt for CCT, and that's why again we opt for investment in human capital, because if you're speaking money, we can prove that with money, again, it is a gain to invest in children. And at that early age, because it's not only for children, it's for development at large, because they are better educated, they are in a better health condition, better personality, better relations with communities, you're working with the households, so it's comprehensive. So I mean, it's a win-win cause by all means. So, and I think finally, the first 1,000 days in the lives of children, actually we were supporting, we started supporting them. We reached around now 40,000 women, and we included it in our family development national program. And actually there is a budget that will be allocated for it. We increased the ration card amount with another, we did not increase the amount of money, but the points. And we conditioned that these points, they should even buy milk, molasses, white cheese. I mean, we choose the nutrients that are very important for a pregnant mother or a lactating mother. And I was just discussing with colleagues, how can we manage in order to educate them? And actually, when I was working 20 or 25 or 30 years ago in development, I learned it from Save the Children and UNICEF, is how to have a healthy and a rational meal with very small amount of money. Yani you don't have to buy the, it's the 7 حبوب يا دكتور. It's the 7 cereals, and how you ground them together and how you do it at home. And actually it succeeded in Africa, and it succeeded also, what succeeded in Africa is the community kitchen. It succeeded very well, and the school kitchen. We as MOS, we did not succeed in convincing our partners with the school kitchen. And they were right, because also, I mean, both of us were right, because they were a bit afraid of the hygiene and the electricity cut-offs and so on. So the first 1,000 days, I think it was very important. In order to have this, everything we do is with condition. Because it's not because we are evil or cruel, but it's because it's not only because of the availability of resources, but I mean because people need to get aware. So awareness with a service buys, I mean, it sells much better. So if they attend the classes, the awareness classes, if they have the health checkup for their children, then they have the extra amount. And we're building electronic network between ourselves, the Ministry of Health, Ministry of Supply, and Internal Trade, in order to ensure then Ministry of Health report that these women had the checkup for their children and the child care checkup, and مثلا if their children weighs better and so on. So we report to the Ministry of Food Supply in order to increase the amount and so on. And same for the conditional cash transfer. So I think, and it's not only the health and nutrition, and then that goes with other classes for improving the communication program is very important. Not only the poor who are less aware of the good nutrition and the good dietary system. It's even the upper classes and the middle classes. The kind of awareness is very limited. And to be fair, the German school did well in the nutrition program. They conditioned that their canteen does not sell anything that is not healthy. So I think it needs a communication program, and this is why UNICEF is supporting us with Hela and Salah. So thanks for their support. And it needs a comprehensive social protection strategy. And that's why we foresee that ECD and school meals are part of a bigger social protection strategy. Sometimes it goes and sometimes it staggers. But at the end of the day, we have a strong will and we're resilient.
Thank you very much for those detailed remarks. And I think I'll first invite everyone who's in the audience who has questions for our speakers to raise your hands and identify yourselves for the microphones that are moving around, and for the live stream questions to also please be asked. While we are passing the microphones around, Karen, I wanted to offer the floor to you for a couple of minutes. There's been so much that's been said in the last 20 minutes. If there are a couple of things that you want to comment on or react to, please do, and then we'll get to audience questions after that.
Thank you, Alison. Indeed, so much said that there's no way I can do justice to it, but maybe come back to a few points. I think, Dr. Ines, what you pointed out on the investment in workforce and kind of both the importance, but also, that's an area where there's really a lot of questions. How do we, especially if we want to scale, either the integration of ECD topics in conditional cash transfer programs or, on their own, parenting interventions or as part of nurseries, etc. In a certain way, it has to start from existing infrastructure in terms of human resources, or maybe not. But then, if it doesn't, then that's a whole new engagement. And if it does start from existing infrastructure, what are how do we get the incentives aligned? Not just how do we get the training of the trainer of the trainers, right, but also the incentives. How do we weigh off the already existing charges that, for instance, the health personnel has with these new tasks, etc. I think there's a lot of questions there. I think some of the challenges we've seen in scaling, in particular early childhood stimulation, are related to those, are related to kind of maintaining the quality at scale. What does it take? And I think there's a lot of important questions there to look at. I fully agree with the importance of that. So let me. So I think it's every minute I spend in the country, I seem to be learning something new and exciting about what's going on. Maybe a quick thought, a little bit, I don't think provocative, but kind of a thought as you were mentioning the grandmothers, and so I think very often as we think of early childhood. Clearly, we need to think beyond the mothers. We mentioned the fathers, but the grandmothers are the obvious.
I like this part very well.
Yeah.
We're working on it.
Excellent.
I conquer exactly what's mentioned.
Right.
Thank you very much.
Right. So there is kind of the extended family, and so especially when we're trying to change practices, we're implicitly addressing issues that have strong social norms around parenting practices, often that get passed from mother to mother, from grandmother to mother, etc. And so how do we design programs, interventions that take that into account and that try to target that extended family, the extended communities potentially? What are the trade-offs? Because that may be more costly. Is it cost effective or not? To increase the target beneficiaries, etc. Lots of questions there, and so I'm glad that this is something that has already been thought about, because clearly that lots of questions there. Alison, let me stop there because I saw a lot of hands and we can go.
Great. Okay, so let's see. We have Jeremy. Maybe we have our two questions here on either side of the front row, and then in the third row. Why don't we take a batch of 3 questions? If you could identify yourself before asking your question, identify to whom it's directed, we'll take the batch so that we can, have some diversity in answering them as well. So why don't we go 1, 2, and 3?
All right, thank you. So I'm Jeremy from UNICEF, and really well done to JPAL for bringing us all together, and to my colleagues, in fact, for bringing us together for such a fascinating discussion. Thank you very much to the panelists. I have the privilege and honor of working with 3 of the panelists much more often, so I'm going to direct my questions to the visitor, because I really want to pick your brains. And it's just 2 or 3 things. Well, one is the minister sort of touched on this. Do we want to integrate children with disabilities integrated or standalone nurseries? I'd love to know. We all have our programming sort of thoughts and opinions, but what evidence do you have on that particular question? Because we also ask the same. We obviously prefer, whenever we can, to integrate, but perhaps you have evidence that tells us something else. The second question is, in view of where we are in the global situation, Ukraine and that kind of thing, I wonder, and this is me just thinking a little bit randomly, definitely off script, but is there any, do you have any evidence that shows what, based on previous similar, if there have been such similar things, where we should be most focusing to protect our gains in early childhood development, based on the kind of scenario that's unfolding now, and where we think that might go? And the third question is, we all agree that we should not privilege certain, or at least there are no standalone interventions for ECD. Everything must be integrated. Nevertheless, there are standalone interventions. So I would like but I think we're always trying and battling, frankly, to move it in an integrated way. What evidence can you point us to that is most catalytic on that journey? Because we do need to prioritize our resources, if nothing else. So what's most catalytic in pushing the integrated model based on the evidence you have? Thank you.
Thank you very much. Based on what Her Excellency just mentioned regarding the importance of the first 1,000 days, in your research, you put that the timing of cash transfer starts at the age of 2. This is what it was in one of the slides, so I was a little bit worried about this. And what about not starting from day 1 to consider the 1,000 days? Because if you are talking about stunting, so this is during this period that you need to address and provide the needed nutrition. Thank you very much. And on the integration, I think that based on Her Excellency also recommendations, we are tackling the early childhood program from an integrated point of view. Of course, Her Excellency knows better, but we have also local NGOs and private sector entities who already showed willingness to join, to provide technical and financial support, with the support also, or the technical support of UNICEF and other UN and international agencies. Thank you.
Okay, my name is Dr. Maha Shafani, and I'm a senior economist at the Middle East and North Africa Health Policy Forum. First, I thank the panelists very much for their efforts and for sharing their outcomes with us today, which is seriously tremendous. First, I start by Dr. Ines's 2 main points. She mentioned the 4 domains of investment in ECD. I think they radically boil down to education as a whole and to equal parental education specifically. My area here is I need to know, or I would like to know, how exactly are you tackling this file of education or parental education, which you have already mentioned a lot during your presentation. The second point, which is the early childhood stimulation, in my opinion, I think this can very easily be achieved through the role of the media. And I want to stress here a bit, because when I was young, I wasn't raised in Egypt, but when I was young, I used to see a lot of child episodes or child series, and it was abundant and amazing, to the extent that I learned my Arabic, Fusha, the formal Arabic, from these series and episodes, and the Egyptian media in these series and episodes were beyond amazing. There were everything you can think of, from manners, environment, being nice to each other, being mercy with the animals, being just humane in every sense. In the 90s, this hasn't stopped. It has completely vanished. There is nothing whatsoever for kids. And I think that this is very vital. This increases their knowledge, this increases their observation skills. It just does a great job. And I think the last thing Egypt has presented was Bakar, and nothing ever since. So the role of the media in this aspect, I just don't understand where is it and why isn't there anything being done here with the ministry. Another point is, what about the children, the very little infant children who are begging with their parents on the streets? What is the government doing with those children? My last point is the nutrition point. Dr. Naveen has thoroughly explained this point, which is amazing. But I think the amount of cancer in children is horrible, and it's on the rise every day. And it boils down to the ignorance of the mother because of what she eats when she's pregnant, and that goes into the placenta. And number two, what kids eat when they're out in the world due to poverty and also due to ignorance. So there is also a very big need of raising awareness when it comes to this part, which can also be tackled through media. My last point was the need for the nursery meals, and Dr. Naveen already mentioned that. So thank you very much.
Excellent. Thank you for that round of questions. Well, maybe give the panelists a chance to pick out those that were a bit more addressed to them. And Your Excellency will offer you the opportunity if you wanted to make any responses first. I understand you may have to get moving. Okay, you'll go last? Okay. All right, then.
Okay. Let me start with the last question on parenting and early childhood stimulation. Correct? Okay. What we mean by parenting education, we have an integrated program for parenting education that has been developed with the leadership of Ministry of Social Solidarity, and it's now fully adopted and it's being mainstreamed nationwide. And the objective of that program is to send to parents messages on how your children can learn through play, how to do positive discipline with children, how to deal with your children in different situations, how to detect developmental delays and what to do when you detect them, nutrition, messages around nutrition, around even mental health and psychosocial support for the kids, for the children, and mental health for the parents as well. So it's a full-fledged program that is being disseminated nationwide through different channels. So we have, it has been linked to the cash transfer, conditional cash transfer program. It has been digitalized into a training program, so those who can access technology can get the information through training, online training, and also for the professional service providers. It is done through nurseries. The facilitators in nurseries are trained to do community awareness campaigns and sessions for face-to-face meetings and awareness sessions. And also through media, we have also the social media. It's very effective in sending those messages and really having an impact on that, particularly in campaigns like the role of the father and early moments matters. So they really, the government has led on several campaigns on social media that were really very effective. And finally, also the role of media. We are working intensively with the media, and we are preparing for an episode that is tackling issues related to early childhood development. فغالبا هتبقى حلقات مش كده؟ كم حلقة؟ 30 حلقة for that. So media, of course, is the key to reach out to the people, and we also have our ambassadors, goodwill ambassadors, and their role in sending messages also to the people and to the children. So in terms of parenting education, I think we have really a very sound and effective program. And what else? The most catalytic intervention that pushes integrated, that's key. That's what we really want to see in local research can guide us on this, because I mean we have seen a lot of research, for instance, like around early stimulation and nutrition. That is very famous, and we have seen that, and it really boosts the impact really significantly than putting only early stimulation or nutrition. I think the issue here in Egypt is that we don't focus on early stimulation as we should. We focus on nutrition, maybe health and other aspects, but when it comes to early stimulation and the importance of play, that is not well understood by the parents and by the caregivers, and that's what we need to focus more on and integrate in the different platforms that we have, because it really gives a significant boost, particularly to the cognitive development of children. Children on the streets, I will leave that to Her Excellency. Disabilities, children with disabilities. Research, we worked a lot on disabilities and integration in primary, and what research says that the earlier you integrate the child and you don't exclude him from the community, the better. Detecting developmental delays at a very early stage and dealing with it while the child is living his normal life within his nursery and his community, I think is the best, and that's what I read in research so far. Particular evidence on that, I think we need more research on this. Thank you.
Let me take your question first. I now realize which slide you were referring to. So we have a study in Nicaragua where we look at the impact of a conditional cash transfer program, and we look at whether if you got it the first 1,000 days versus if you got the same program a little bit later. And this is particularly for boys. And so what we show there is that for stunting, so for the nutritional outcome directly, if you get it later, so if you get a package of conditional cash transfer, the whole package of that these things come, there is catch-up for growth. So for stunting itself, for the anthropometric outcome, it is possible to catch up. However, for cognition, it is not. And so that is the remarkable finding there that confirms the importance of the 1,000 days rather than so if you look at the cognitive outcomes itself, it's very clear that even if you get a very successful program a little bit later in life, the boys are not able to catch up on the cognitive outcomes. So that's kind of, I went too quickly over that slide, but that's that result. And so indeed, the importance of the early time. And so I actually think that directly links to the question on Ukraine, or on the Ukraine crisis. So we know that there is certain, or we have good reasons to believe from both the medical, the nutrition, and the economic literature that there are certain windows that are particularly important, right? And so basically, I think what that means is kind of looking ahead and knowing that there will be, that it's likely that food security is going to be a concern, in particular for the poorest households. And we also know what it takes. We know that it's, it is indeed a package, but there are certain, when households are going to be liquidity constraints, kind of there's certain things you're going to start saving, whether that is the animal proteins or whether that's the fruits and vegetables. And so thinking proactively about that, I think, is where I would think that kind of the low-hanging fruit is in a certain way, in particular post-COVID. In particular, since we're coming out of a period where there is already cohorts that were at more risk, and now you'll have, focusing on those cohorts for which it particularly matter, I think would be kind of one kind of plausible way of taking that forward. I'm going to answer the question on disability slightly differently. There is no, as far as I know, very little global evidence of programs specifically targeting children with disabilities kind of very early on in life. But what we do know, and I think the minister hinted at this, is certainly the exact reason why we want to focus early on in life is because some of those disabilities have their origin in those early years, right? And so whether that's the socio-emotional components of it, the personality, etc., and of course the importance of in utero. And so I think that's kind of, I mean, that speaks for integration indeed. That speaks for kind of having this thinking of this in this integrated fashion, and in particular focusing. We know there is also very strong socioeconomic gradients in cognitive and in socio-emotional outcomes, no matter where we look. And so that speaks for targeting and trying to avoid some of these very strong delays. And whether I think that the line between developmental delays and certain disabilities is very fine. And so in a certain way, I think this kind of speaks for this agenda more than anything else. Of course, then there are, I'm not saying this is all the disabilities, and I think there is clearly a need for more evidence on programs that target specifically and whether integration or not in early childhood. And so on the integrated models, so this is, let me actually share some of the work we're doing currently in Côte d'Ivoire, where that's kind of one of the questions we're looking at. So I hinted at this before, so kind of, if you look at the existing infrastructure, how do you use the existing infrastructure and then build on that to integrate? So for instance, there we're actually doing two parallel RCTs. One of them where we start from the health infrastructure, so the community health workers and the rural hospitals and clinics, and then try to train, kind of a trainer-of-the-trainer approach, integrating basically stimulation into their existing curriculums. And then the other one, a different model, which starts from social workers and preschool teachers, and then training parents on both the nutrition, the positive disciplining, and the stimulation side of things. And so a priori it's not. So we're looking at both because the government in Côte d'Ivoire says, well, we want to scale, but we don't quite know which way to go, and there is good reasons to believe there is trade-offs. And so what you see is kind of what you would expect, I guess, is when you work with the local health personnel, in a certain way they naturally are biased towards the nutrition and the preventive healthcare messages, right? And so you need to be very aware of that and be very conscious in a certain way in kind of re-emphasizing the stimulation, the home environment part of things. And you probably need to do the opposite when you're working with the social workers and the preschool teachers, right? And so thinking there about what is it that you need in addition, or kind of either on training side, on the monitoring side, and complementary supervision to make that happen, I think is one of those things that potentially is also relevant.
I'd like to add that we have a screening program for two diseases, early disease, hypothyroidism and phenylketonuria. It started 20 years ago, and we added recently 17 diseases to the panel of hereditary and metabolic diseases. And in addition, we are planning for screening for malignancies. 4 malignancies we are starting with: colorectal cancer, prostate cancer, lung cancer, and cervical cancer. That could address the question of screening and malignancy. Thank you.
Final remark. I'm speaking about, just to continue what Ines was just mentioning about ECS, is that through our new curriculum discovery, We have different modules on many issues, and I think focusing on the sensory issues, it's not reading and singing, also touching and smelling. I think these sensory issues is very important for a child, where he tastes, smells, and feels life, including early detection طبعا and positive parenting. And we have a committee of not only NGOs and international partners, government, but also from academia. And that is quite revising the curriculum up to the international standards. As for the language of the linguistic parts of the curriculum, it's being revised by UNICEF and other partners in order to match the Egyptian culture, because the one that is doing it is an international partner, which is Discovery. As for the media, I think lately we have many issues in the media that are up, but the ministry is working on too many issues. We have مثلا one series on autism, because people do not understand quite well autism. We have another on foster care children, another on violence against women, or on family and child law. We also have another program on positive parenthood, which was not before tackled in the media, which is Abu al-Arusa. It was, by the way, although it's not per se something on nutrition and ECD, but about the parenthood, and especially the father model, was very important. So, and that's why I agree with Karen about that the father has to be there more, and we should work more on his not existence, but integration within the process itself and inclusion. And I think the more, maybe it's a positive bias that we are focusing more and more on women, which is good, but in the midst of the way, we forgot all about men and all about fathers, and eventually they themselves lost a part of it, and we lost a part of them. So I think that's why we're coming back with that العالم يحتاج إلى أب. So with another program that we're focusing on fathers and focusing on their inclusion, because I think it's not only that we need the fathers, they need to feel their parenthood. I think also the issue is the behavioral change is that it is a process. It's not one ad that might change, but it needs lots of also field work, and that's why we're increasing our community workers from 3,000 to 20,000. The household needs one visit, 2, 3, 4, 5, and they need to talk amongst themselves, and then to revert back to the community worker, to ask the religious leaders, and that's why we're working with religious leaders, Muslim and Christian, in order to unify the messages about everything that is related to children, because even some of the religious leaders say, La haram, don't let the children get out of their mother's hug and go to nurseries. We're not depriving them of their mothers. It's a part of their growing up. It's a part of their right to see other children, to play with them, and so on. And we have Ahl al-Hitta, which was about 20 years with UNICEF, and I think it left a very good impact in Ramadan. It was broadcasted on social media, 10th to 30th of Ramadan. It was a good experience, and we're eager to repeat it more and more on different aspects, and even on TV. And in addition, we have our share in radio, إذاعة البرنامج العام and إذاعة القرآن الكريم, 2 hours every day, in order to broadcast our messages, our work, and not only us, but our partners. So it started. It's not the best that we can do. I mean, we can do more. Media is costly, but nonetheless, the president agreed even to make this even free for behavioral change. And that's why we have a big program on بالوعي مصر بتتغير with الوعي Egypt will change. And it had even street theater, going to villages, having plays with children and so on, in order to have it as a cultural and behavioral change and not as preaching, and opening up the services. I think when why or when awareness is combined with services, it's much more authentic, especially with if you're targeting poor households. The last thing about the children begging or the street children, to our surprise, we've just finished a survey on screening or surveying street children and elderly without care. It's very diverse because a big portion of them have homes. The issue is that they don't go to their homes frequently. They spend nights on the streets. And so we came to realize that, when I first read the results of the report and the findings, I was a bit shocked because I found out that the numbers have increased. So she told me, they have homes, but the issue is that they spend hours on streets and they spend nights. They are not even the street vendors. Sometimes they are calculated as street children because according to the law, they are selling trivials. But they are selling because they are gaining their lives. It's not begging. When they sell Kleenex and they keep nagging and knocking on the doors of the cars, they think that it's business. So we have to create something for the household so as not to send the children to streets. But also we have issues with street families. It's not having mothers and children, and we began to do some sort of examinations in order to ensure that these children belong to these mothers and that these are their mothers, actual mothers, and not kidnapping the children from anywhere. Added to, there are certain types of persons without care who have psychological problems, and because it's stigmatized, مثلا elderly who have Alzheimer or who are schizophrenic, and the families do not know what to do, so they just leave them, or the elderly, they forgot about who they are. Even we issue ID with the support of Ministry of Interior till we find their families or till their families ask more and more about them. And we just finished a program which is it's aging program that screens the children even if they are, if you come to screen the child or the elderly, if you have the picture while the child is lost, you can screen the child back then. So I think we have 17 mobile cars. They are roaming the streets. We have the speedy intervention helpline in order to report on where do they find the children. And we added, we increased our social care institutions for children and elderly without care with 40 social care institutions. Not all of them are, the occupancy rate is not 100%, because sometimes people come and they just leave and they like the street freedom better. And that's why we're working with the Ministry of Education on launching a campaign on that is called الشارع ليس مأوى. And that, and the more we can combine or integrate the children with original families, we do. But I think now we're working more with NGOs. NGOs are very astute in tackling this issue, and now they have more experience. And actually, I think also we previously had the support with UNICEF. They had a big program on street children where they established more than one social care institution and build or enhance the capacities of social workers by thus I just end up with the certification of social workers that my colleague Naveen Osman also is actually is not only working on nurseries and Amina and Mirwat, but Naveen is also helping us in certifying, having certified social workers, and this is what we would like to see in the nurseries. It's not only being graduated from a faculty, but being equipped with enough knowledge and skills and prepared to care for children. Thank you very much, and once again, I thank you for inviting me and for having this distinguished panel with dear colleagues, and special thanks to Dr. Karen. Thank you.
Thank you. Thank you very much. I think in light of time, we should wrap up and transition to our coffee breakout in the foyer. I know that there are more questions. We have some detailed questions that came up online around what the differences between at-home and ECD center-based interventions can look like, what some of the details of effective stimulation programs for children can really look like. So I think there's a lot to discuss over coffee. It's also evident that the comprehensiveness of the early childhood development space requires the contributions of so many different organizations and so many different forms of expertise. So we're grateful to have all of you here on the panel today and those who are here in the audience. So please join me in thanking our panelists. We're so glad to have Her Excellency Naveen Al-Kabbaj with us today. Dr. Wael Abdul Razak, thank you so much for being here from the Ministry of Health and Population. Karen McCours, J-PAL affiliate, and Dr. Ines Higazi from UNICEF Egypt. Thank you very much to the panelists, and thanks to all of you for joining us.